questions on the diet. One of the things that you realize in looking at research is the number one way to get patients to modify their lifestyle and modify their diet is actually a doctor telling them to. So in this book, the Toyos Dry Eye Diet, I get really specific on what I want my patients to eat. I even have a 2-month starter diet to get their gut in order. We now know if you have an acidic gut, you're going to have an inflammatory system. And if you have an inflamed system, that's going to affect your retina, it's going to affect your dry eye, it's going to affect everything. So I think it becomes very important. Along with this, now we have the GLPs. Now, I do this every time I do this lecture. How many people here know somebody who is on a GLP? And it's probably more than that. So if you all of a sudden go to clinic one day and you see that patient and they look completely skinny and totally different, you know it's probably going to be a GLP. So why do I get into GLPs? And we actually, in our clinic, we've been prescribing GLPs since 2021 with our own pharmacy. But when I started the clinic 27 years ago, I didn't start it just as an ophthalmology clinic. I started as an ophthalmology and aesthetics and wellness clinic. So all of my colleagues were like, what are you doing? Why are you getting into aesthetics? Why are you getting into anti-aging? Why are you getting into wellness? And they didn't think it was a model that actually would work. But what it turned out is that model really worked. Patients were hungry for aesthetics treatment. So if you look at all the things that we are doing in our clinic, it all stemmed from those days of the wellness clinic. Intense pulse light wasn't discovered in my ophthalmology clinic. I discovered it in our aesthetics clinic. Platelet-rich plasma eye drops wasn't discovered in the ophthalmology clinic, but in anti-aging. Low-dose naltrexone wasn't discovered in ophthalmology, but was discovered in our anti-aging. So GLP is just a natural extension of everything that we're doing. So GLPs are one way of treating diabetes, and we're going to get into diabetic retinopathy in a second. But it's an injectable that patients do once a week to control their blood sugar. But lo and behold, they found that it was a great treatment for obesity. So what's happened now is that you have a group of diabetics that want GLP to control their blood sugar, but you have more people wanting to use it as a weight loss drug because it is working so well. So through our pharmacy, we started prescribing it, and it's something that has been going on and has been really successful here over the years. But little by little, what we're discovering is that not only having patients lose weight, but it may have some other benefits for any inflammatory disease that patients may have, whether that be age-related macular degeneration, dry eye disease, overall health. So we've seen this before with metformin, which was given as a diabetic drug, but little by little, you saw that it was used for anti-aging. It was used to control systemic inflammation. You see that it was now patients are told that if they use metformin, they will live longer. So how does metformin work to do all these different things? And it'll lead into maybe why GLPs are working. If you haven't heard the term hormesis, unspecifically is anything that doesn't kill you will make you stronger. And it turns out this whole wave of things that you're seeing, whether it would be jumping into a cold plunge. How many people have done a cold plunge, right? Jumping into a cold plunge. So these things are stimulating the genes in our body that will lead to longevity and also lead to better health. So they've isolated 7 of these genes. They're called the sirtuin genes. And what we're trying to do is do all these different things to actually stimulate these sirtuin genes to help us live better and longer. And it turns out some of these plants, whether it's green tea, drinking some green tea to get some gallate, or it's taking metformin, which is from a lilac, or drinking a Pinot Noir, which we had a couple of Pinot Noirs or some red wine yesterday. Well, it turns out these plants, when you stress them out, they actually make compounds that if we take, they're actually going to stimulate sirtuins. So it turns out metformin actually stimulates sirtuin. Resveratrol in red wine actually stimulates sirtuin. So metformin has kind of shown us the way. It actually stimulates mitochondria to work better with the AMP enzyme, stimulates sirtuins to work better. And we now know that metformin actually can prevent age-related macular degeneration, and it may be an inexpensive treatment for the prevention of AMD. Then if you look at the animal model, it turns out that metformin and GLP, they actually stimulate neuroprotection in all of the layers of the retina. And it's doing more. It's actually helping develop good gut bacteria so we don't have an acidic gut. There's a study that was shown where patients who were taking metformin, they did a fecal transplant into mice, and then they found that the mice actually developed the same gut bacteria and stabilized their blood sugar. So the GLPs we're finding it's doing the same thing. This is a study that's hot off the press, just published at the end of January. And it was looking at patients that have been taking either GLP, metformin, insulin, and they've been on it for at least 5 years, and seeing if it had any effect on the prevention of AMD. And it turns out the GLP actually did the best in terms of preventing AMD and also in preventing dry AMD to go to wet AMD. And this is in the diabetic and the non-diabetic. Also, it reduced POAG. So is this a neuroprotective for glaucoma? So I really think GLPs may be changing the game, and why they're estimating that this is going from, in the United States, from a $47 billion market to a $427 billion market. And there is no side effects in terms of increasing cataracts or increasing ocular hypertension. So this is a diabetic talk. So if you have quick control of your blood sugar, what can happen? Well, diabetic retinopathy could get worse. So that's one thing with these GLPs, and why you should be asking your patients if they're on the GLP, because they could be coming into your office, their blood sugar is better controlled, and they're actually, their diabetic retinopathy is getting worse. Now it turns out that over the course of time, that diabetic retinopathy actually will subside and stabilize back to normal. Another thing to worry about, this is a Harvard group study showing that it may lead to an increased incidence in NAION. So you may have sudden blindness going into these GLPs with this quick control of blood sugar. So it's actually a 4 times more risk factor for NAION in patients who start taking a GLP. So what's a possible mechanism of action of these GLPs? Well, it turns out this receptor is in many different parts of our body, not only the GI and pancreas, but in our CNS, cardiovascular. It's exerting an anti-inflammatory effect. So the inflammatory mediators that we see in ocular disease are T cell mediated. So these GLPs actually decrease the D cell mediated inflammatory response. And again, I said it's neuroprotective. An indirect response, we know if we can lower people's BMI, their cardiovascular system will be much stronger. You can control hyperlipidemia, then you're going to be much healthier. And then GLPs are finding the same thing that they found in metformin, is that it is controlling gut bacteria. All right, so that's all the great stuff. Let's talk about maybe some of the bad stuff. So Ozempic face. So what is the downside of the GLPs? It is actually a muscle waster. So a lot of these patients who are on Ozempic, they lose a lot of weight, but their face looks like it. So they look a little bit like zombies, right? So, but is this going to be an efficient way for us to control AMD, diabetes, diabetic retinopathy? Well, it turns out that it's now being approved for cardiovascular. So if you have a cardiovascular risk, you may be put on a GLP to decrease your cardiovascular risk. Now it does worsen diabetic retinopathy, but trying to weigh this out. What's worse, diabetic retinopathy or the risk of dying from a heart attack? So what are we spending on AMD? We're spending $49 billion. This is a study looking at some different countries. $49 billion in the US, 7.6 billion euros in Germany, 449 million euros in Bulgaria. So as the cost of these GLPs go down, it might be economical for us to be using more GLPs and doing less injections into the retina. It's also lowering Alzheimer's risk. So economically, I think the GLP market may be taking control of where our dollars, healthcare dollars, are going to be spent. So what starts to happen? Once you find something good, you're going to have people who are trying in the anti-aging market to try to make this into a drug that they can take. So they're already talking about microdosing GLP underneath the tongue to get all the anti-inflammatory effects without any of the side effects. And then here are some of the side effects: nausea, vomiting. These are all things that patients have been complaining about: constipation, upset stomach, lack of appetite. There's even lawyers out there trying to say that there's a cancer risk through these GLPs, but that has not been confirmed. What we're looking at is, in the dry eye space, can GLP help those patients who have severe dry